Hello again, everyone. My name is Marty Guthmiller, and I'm CEO at Orange City Area Health System. Today's a special day. We're bringing you the 30th edition of the COVID-19 community briefing. Quite frankly, I wish we didn't reach 30, but anyway, the 30th, and you're keeping track. Not a lot of different structure to today's meeting or briefing. I'm going to give you the latest in terms of what's going on in the area. First of all, locally, we've done 464 tests. That number is climbing. The good news on the testing front is also supplies appear not to be an issue anymore. We have instructed all of our providers to test anyone at this point that is presenting clinically and that has reason to be tested. So our supply is good. We have no reason to believe that it's going to change. And so our testing issue is, I think, kind of resolved in terms of how things have been going. Of those 464 tests, 38 have been positive. That's jumped 5 from Monday. So we've had 5 additional positives since Monday. But that still represents an 8.2% positive rate, which is kind of where we've been along the line here. We do have 24 tests pending, but again, nothing outside of the norm in terms of what we expect in that area. Sioux County has done 2,212 tests. That's 1 out of every 16 residents in the county has been tested. 363 of those tests have been positive. That's up 5 from Monday. Well, guess where the 5 came from? Orange City. And so the county test positive rate is 16.4%, steadily coming down. That number on Monday was 16.7. The number yesterday actually in the county was 5%. So only 5% of the tests yesterday in the county were positive. Again, with the county, the demographics haven't changed at all, or 80% of those positives are in the 18 to 60 year old age range, and that hasn't changed. Region 3, numbers are improving again. 70 hospitalized in Region 3, the 20 counties in Northwest Iowa. That number on Monday was 74. 2 patients have been admitted in the last 24 hours in this 20 county region. 24 patients are in our ICU, or in the Region 3 ICU. That number is down 5 from 29 on Monday, so good news there as well. Looking at the entire state, we've tested now 1 out of 13 Iowans, 234,405. Of that 234,000, 24,380 have been positive. So that's a positive rate of 10.4%. So we're getting down at the state level into kind of what was expected overall in the long run in that 8% range. We're heading in that direction, but we're not there yet. On Monday, the number was 10.6 as an example. The other thing that we've been following is hospitalizations. Again, one measure of the level of acuity that we're having with these positives. Again, good news. At the state level, we're down to 176. That is down from 183 on Monday and down from 245 just 5 or 7 days ago, June 10th. So June 10 was 245. This past Monday was 183. And this morning, coronavirus.iowa.gov reports 176. Looking at those hospitalizations from a more regional perspective, we remain at 0 for Sioux County. There are no COVID hospitalizations in Sioux County. Lyon and O'Brien, again, are at 0. Plymouth County moved up 1 from 2 on Monday to 3 today. BV County jumped up a little bit from 17 on Monday to 23 today. Dickinson and Clay County remain at 0. We talked about some kind of a uptick there, perhaps, but I'll talk a little bit more about that in just a moment. But currently, Dickinson and Clay have 0 hospitalizations as well. Woodbury County continues to decrease as well. from 32 on Monday to 30 today. So that continues to go down. Good news in Woodbury County. Polk County as well, going down. 39 on Monday, 31 today. So generally speaking, good news across the board. The biggest negative was probably that we've had 5 positives here since Monday, tested positive, all on an outpatient basis. None of those have been hospitalized. And so again, fits in with the level of acuity that we've been experiencing. Now, with that said, not all the news is good. There have been, it was announced today that there's a long-term care outbreak in Dickinson County. One long-term care facility, one nursing home that has had or currently has 10 positive cases. So that is not good news. And that's the environment where you do not want the outbreak to happen. So one outbreak in Dickinson County nursing home. Buena Vista County has now 2 nursing homes that are in outbreak status, but they're at the minimum level outbreak, which is 3. So each of those 2 nursing homes have 3 positives, but there are 2 nursing homes in outbreak status in BV and 1 in Dickinson County. Because of this vulnerability, and I've talked about this before, with particularly our senior care population, don't expect any dramatic senior care changes and relaxation of our policy at Prairie Ridge for a couple weeks, probably early to mid-July at the earliest. And that's provided that we have no outbreaks between now and then. If everything goes as it has been going and we have no outbreaks, we'll be set to move into the next phase in early to mid-July. And we'll talk a lot more about that as we get closer to that date. But don't expect anything to change very soon. And again, Dickinson and BV counties are some good reasons, relatively close, why we don't want to do that. Just a little bit of other information. The Test Iowa site, our understanding is going to remain in Sioux Center until June 23rd. And so if you have an interest in doing that, that should be there until June 23. Go to testiowa.com or .org, either one, to figure out the exact steps to take in that. I think pretty straightforward. If you want a test, you're going to be able to get one. But again, I would think that most hospitals and providers in the county are going to be able to provide that pretty quickly as well, if not today. So Test Iowa through June 23rd. Reminder of the immunization notice, plea, if you will, to make sure your children are up to date with immunizations. Again, we don't want the effect of COVID-19 to be more than COVID-19 itself. So please make sure your immunizations on your children are current. If you need some immunizations, make sure that you get those as well, along with your wellness updates as you normally would be. Very, very important to maintain the your health and wellness profile. Finally, just remember to control what you can control. This thing is not over. I think Dickinson County and BV would be testimonies to that. It's not over. And yet you feel that a lot of people out there are acting more like it is. It's not. We understand that. We will protect the most vulnerable in our community as best we can. And I think that's probably a good approach at this point. We need to get back to living our lives. We need to be able to assess the risks, and that's going to be different for everybody, quite frankly. And so remember to control what you can control. Utilize grace in your interactions with people. Give people the benefit of the doubt that they're trying to do what they feel is best for them. So I'll close the way I've normally closed. to, first of all, thank you for joining us. And remember to stay strong, stay vigilant, and most of all, stay healthy. Thanks again.